I was quite surprised by that. I knew that it could last after birth. I just didn't assume it could turn into a long-lasting hypertension. I assumed that like, okay, once your body's healed up a little bit, it's going to go back to normal. And it's going to do what it's supposed to do. So I remember at that 6-week appointment, she's like, it's still running high. So going into the fact that now you have hypertension, now you're going to have this treated differently by your primary care physician. So that was more surprising to me.
Hey friends, my name is Kelly, mom of two, and the host of this podcast. Today, again, I am joined by Jennifer Councilor. Last week, we discussed her I had no ideas throughout parenthood so far, so definitely go back and check out those if you haven't already. But to recap, in case you missed it, she grew up in Michigan, and she is now living in Kentucky with her husband, Jordan, and her son, Parker, who's 5, and Jameson, who is 3. And she also has a baby girl on the way. Today, we are going to be going through her experiences with preeclampsia, postpartum preeclampsia, and then ultimately turned into hypertension. So let's get started. Jen, thanks for coming on and chatting with me again today. Today, we're going to be getting into more detail your story with the preeclampsia, the postpartum preeclampsia, and the continued hypertension that you experienced. Yeah. So what was your kind of knowledge about preeclampsia? Had you known anybody who had it, or like what did you think of when you heard preeclampsia?
You know, I didn't know anyone that had preeclampsia. I was aware of it. When I work in the healthcare field, I kind of know what it is. We've all seen the TV shows, Grey's Anatomy. There was a situation with preeclampsia there and the patient died. I'm recently rewatching Downton Abbey, and back in those days, that was a death sentence. So you knew that it was serious. I think today, the doctors, at least in my viewpoint, I didn't have like 6 weeks to go to visits and go through treatments or anything like that. It was kind of like, okay, you have preeclampsia, let's go ahead and have this baby. But it was never like made to be like a super scary thing. I know it can be scary. I know it can cause multiple issues throughout, but I think, you know, with today's medicine and science, they know how to treat it. They know how to handle it. I had a lot of swelling. My doctor told me it was normal. It was normal, but by the time I had checked into the hospital for my induction, I was swollen. Like, I actually hate any photo of me taken with Parker after he was born, because I was just like this Oompa Loompa. Like, I was so puffy. I was retaining so much fluid from the preeclampsia. So it's one of those things that honestly, if I would have had to be with it for a while, I could see how that would really affect me. It could have affected the baby, and it could have been a lot more serious. I've learned since then, you know, especially with my second pregnancy, they don't mess around with it. They take all the precautions, and any warning signs that, you know, they will do what they got to do.
Yeah. What was your mindset then when they told you and you got diagnosed with that?
Well, for me, I think it was good for me personally not to have a long time to think about it. It was kind of like, okay, well, this is what we have to do. Like I said, I had felt pretty good. I wasn't having like headaches or, you know, blurred vision or anything that was kind of associated with it. I had no idea I was feeling off or should be feeling off. So I luckily didn't have too much. I'm a very well-prepared person. My bags have been packed since I was like 32 weeks. So I was really prepared. It was just mentally being like, oh, I'm going to have a baby like any day now, when, you know, in reality, I was like, oh, it's 2 or 3 more weeks away, wrapping my head around that. So I didn't have a lot of nerves or scared about what was to come because I didn't have a lot of time to think about it. Now, if I had to go home and had like a week or two, I would have probably done all the research and read all the scary things, and that probably would have been harder for me, but I didn't have the time to think about it. So I will say I got a little bit lucky in that sense.
Right. And you really trusted your medical team.
Yes,
right? So
very much so.
That's helpful.
Very much so. So with my first pregnancy, I saw my same OB the entirety of my pregnancy. She was a friend of a friend, so I kind of knew her outside of the OB office. Trusted her 100%. But the funny thing is she was going to be on vacation when I was 37 weeks. She's like, you're not going to have this baby. Don't worry about it. She's like, you're going to see my partner. She's great. And I'm like, okay. So when I was 37 weeks and got diagnosed with preeclampsia was when me seeing this brand new doctor that I hadn't met before. And she was wonderful. I loved her to death. My original OB left the practice shortly after that. So the one that ended up delivering Parker and going through all that with me delivered Jameson was my OB for my second pregnancy and now for my third. So that 100% makes a huge difference.
Yeah. Oh, definitely. That's nice. At least you liked the one that had you not seen her at all before?
No, my
Wow.
office, I don't know if I got lucky. My office, I was able to see my OB every single one of my OB visits.
Oh, okay.
Now with my second pregnancy, I saw more of the providers through the office. I think it was because they had influx of patients. They were busier these days, so it wasn't as easy to get the appointments. So I got to see, I think, almost every provider in the office, which was nice because if it came down to it and I had to have one of them deliver, I would at least be aware of, I've met them. And I love my OB office. Everyone in them is great. Now I'm partial to my particular OB. So she is also pregnant right now. And so I was like, oh
Oh,
no, I'm so happy for you. But oh no, she's like, don't worry,
but
unless you go into super preterm labor, I will be back. And I was like, okay, thank goodness.
yeah. Oh gosh. Yeah, I think with my first, I pretty much just saw that one doctor and like
Yeah.
he was the one that ended up delivering, but my second, when we moved to a new area, that was like a requirement actually. They made you
Yeah.
see every single provider in the practice just in case,
Yep.
which
I think some do that
was
now.
nice, but right, yeah. And
Right.
it was like it was nice, but also like, you have your one main person. And
Right.
I got lucky again having, well, and I had a C-section, but so like it was
Right.
scheduled.
Right.
But I thought that was kind of clever in a way because
Yeah.
the chances of you always
Right.
delivering with that provider, you just never know. So
Right.
getting familiar with the other providers in the practice and making sure you like them too, or like,
Yeah.
if you're
It
going to have beef with them at all, this is good
it
to
makes a
know.
difference. That's for sure.
Yeah. Okay. So preeclampsia is, from what I researched, only about 2 to 8% of pregnancies are, diagnosed with preeclampsia. Did they tell you like it was kind of rare or?
They didn't go into a lot of detail. I think being a short type of notice, if I would have had time, I ask a lot of questions. I do a lot of
For
research.
sure.
I probably would have gotten that information from them. But I kind of knew from my knowledge that it wasn't super common.
Hmm.
Something if you have a history of hypertension, those are the things that they would keep an eye on throughout your
Hmm.
pregnancy. And I didn't have a history of hypertension.
Yeah.
I have a family history, it's very prevalent in my family history. But I personally did not have any trouble with it. So, it wasn't something that was extra monitored other than, every visit you get your blood pressure taken and all the
Right.
normal checkups. So I knew it was, somewhat rare, but I wasn't super concerned about it for myself.
Yeah. Yeah, I was honestly surprised to see that statistic because like I've heard about it, and usually those
Yeah.
rare things like you don't always hear, but maybe it is like like you said the TV shows and stuff like that. They have,
Yep.
clips of that, but yeah, I was surprised to see it was that low of a percentage, but
Yeah. Well, and I think too the other thing that they don't take chances. So if you start having
yeah.
high blood pressure readings, that's not necessarily preeclampsia because they have to have that
Right.
like protein in the urine to have that
Mhm.
diagnosis. So, I had a family member who wasn't diagnosed with preeclampsia, but she was essentially treated with it with the magnesium and everything like that because she had the high blood pressure. I
Oh
have
wow.
another friend who was pregnant currently, and she's like, I've had a few high blood pressure. I'm like, well, are they doing anything about it at this point? No, we're just kind of keeping a waiting eye on it. But it's one of those things I think that blood pressure can raise. We have a
Mhm.
lot going on in there,
Yeah.
but it's not necessarily always a preeclampsia diagnosis.
Yeah. Had they mentioned anything to you? Have you heard of HELLP syndrome?
No, so actually they didn't mention that to me.
Okay.
When you sent me the question about it, I actually looked it up myself because I was,
Yeah.
I've seen the acronym, but I was like,
Mhm.
let me make sure I know what it is. Wasn't 100% sure. It was never brought up to me.
Okay.
Um, but they did a good job of like controlling
Yeah.
everything in the hospital. Like I said, I had very little complications. I had high blood pressure readings. I think the highest I had um, during my stay was like a 160 over 110. I remember that freaked my husband out a
Okay.
little bit, but it
Yeah.
wasn't like they came in the room, they saw the alarm, they turned it off. There was no like adjustments.
Mhm.
Baby wasn't in distress or anything like that. So, nothing came up. So it was never mentioned to me, but I'm sure had something happened, they would have acted
Yeah.
swiftly and maybe gave me a quick synopsis of how we need to handle it.
For sure. Yeah, I think probably a couple years ago now, I had heard of the HELLP syndrome. And I know they're all like different, right? But
Yeah.
yeah, I was just curious about that because my sister kind of just went through that where they were concerned about possibly preeclampsia, and then they were like, maybe HELLP. And I had mentioned it to her because I was like, are they looking out for this? Because this is like kind of like that or like mimics that in a way,
Right.
but can also be very severe and whatnot. So I was just curious if that was ever brought up.
No. Yeah.
So tell me a little bit about postpartum, because this then continued for you, correct?
Yeah. So, after the baby was born, they definitely monitored everything. I was on the magnesium for 24 hours afterwards. I was able to come off of that once things were in safer levels. And when I was discharged from the hospital, I got all the normal ibuprofen, the stool softener. I was given a Lasix water pill before I was discharged because I had all that fluid. I finally put off a lot of that fluid in the hospital. That was basically from my preeclampsia. And they discharged me, but I was also discharged on, I think it was an aspirin, if I remember correctly. I think I was discharged on an aspirin to kind of keep my blood pressure down. And then, they had the typical follow-up. I think I followed up instead of a week after, I followed up fairly soon to get like a blood pressure check with my OB. It was still running a little bit high, but nothing was changed majorly. Kind of staying on the aspirin. And then I followed up within a week and then did my 6-week checkup. So when I went for my 6-week checkup, my blood pressure was still running high. And my OB explained to me at that point, it's not considered preeclampsia anymore. So anything past that 6-week postpartum period is not considered, pregnancy related at that point. Your body's had enough time to recover. It's not related to that anymore. And then she explained that preeclampsia can turn into a hypertension, a long-term hypertension, and that you will want to be aware of that probably for the rest of your life. There's always a good chance that you could be more susceptible for hypertension or anything like that. So at that point, she said, you need to go to your PCP and they will, then monitor the hypertension and treat that from there. So I went to my PCP and he treated me with lisinopril, common hypertension medication. I think I was on the lowest dosage, and that got me under control. I was on medication for about a year and a half, and I, may have not needed it quite that long. But that was a time that I spoke to my provider and, I had lost the baby weight, at a year and a half, those types of things. And he had told me this originally from the start. If you're doing well, we can wean off the medication, see how it goes. So I said, I think it might be a good point. And he goes, I agree. We'll wean you off the medication. And I was able to wean off and didn't have any issues. I am definitely more aware of it at this point in my life. So if I'm not feeling right, I got a headache, I'll take my blood pressure. I'm always going to be aware of that. If I'm not feeling well, or I had bronchitis, like last year, and they put me on a steroid and I wasn't better, had to go back in, and my blood pressure was high. They wanted to give me another steroid, but because the steroid increases your blood pressure, they could not. And with my history, they weren't going to risk that. So it's just one of those things I have to be more aware of. And they treat that differently in subsequent pregnancies as well.
Right. So with your second pregnancy, then did that pop up again, or what happened with that?
Yeah. So the first thing they do with the subsequent pregnancy, when you have that preeclampsia diagnosis prior, is you're going to get extra monitoring. So, my first OB appointment with my second pregnancy, as well as my third, I went in, I had the ultrasound, I had all my lab work, but I additionally got to take my sugar test. I do a baseline sugar test at the beginning, and then I'll do one later on as well at the normal, was at like 26-week mark. And so you get extra monitoring. At 12 weeks, I start a baby aspirin. And my doctor told me the statistics that it only has about a 30% reduction rate of possibility of preeclampsia, but she said that's better than nothing. And so with my second pregnancy, I took an aspirin from 12 weeks all the way up to delivery. Once I hit 32 weeks, we do some extra monitoring. I would go in twice a week. One appointment would be an NST appointment, and then my second would be an ultrasound appointment. So they would go in and make sure all the movements and everything are being done. So that extra monitoring came in handy. And then in my second pregnancy at 37 weeks, I had normal blood pressure readings all the way up until my 37-week appointment. I went in and I had one, I think it was like 140 over, 80 or 90 or something. And they took it 2 or 3 times during the appointment. And sure enough, they're like, well, you're 37 weeks. We're not going to take any chances. For us, I was trying to put it off a little bit. I said, hey, can we wait? It was like a Tuesday or something. I said, hey, can we wait till like Friday? The friend we had that was going to watch Parker for us, her family had COVID, still getting through COVID at that point.
Yeah.
And so I was like scrambling. I was like, I didn't know what we were going to do with him because my hope was we would make it a couple more weeks. We wouldn't have to worry about it. So we had to scramble. And the doctor essentially was just like, nope, we don't take a chance. Preeclampsia can happen in a split second. Things can go downhill. He goes, I'll give you a couple hours, but I want you at the hospital. And so they went ahead and induced me. I think I had one other blood pressure that was a little bit high. But for me, luckily, I didn't get a preeclampsia diagnosis the second time, and I didn't really have any blood pressure issues during, labor and delivery. So I didn't have the magnesium or anything like that. I didn't have to be discharged on any, medication or anything like that related to the blood pressure.
And then postpartum, did that like all go away this time?
Yep. I didn't have any issues with my blood pressure this time. Of course, I
good.
monitored it. The doctors were, of course, monitoring, making sure nothing came up, but I didn't have any problems. So, I asked my doctor during my second pregnancy, well, am I more susceptible to preeclampsia because I've already had it once? And she goes, actually, statistics show that you're almost less likely to have it because it's almost like your body has learned how to handle the scenario. So you'll hear a lot of people who, like for me, my first pregnancy, my nausea and vomiting was awful. The morning sickness was terrible. And my subsequent pregnancies, they haven't been great. I haven't felt perfect, but they weren't as bad as it was. And it's almost like your body can kind of learn, oh, this is how we can handle it. It's handling it better than it did the first time. So she said, a lot of times you don't typically get it again. That doesn't mean you won't, but she goes, but statistically it's a little bit lower. And I was like, well, that's good to know.
Oh yeah, good. Backtracking a little bit, I wanted to ask, so when you were going through that like postpartum period the first time then, and through that first 6 weeks, were you feeling symptoms?
I really didn't feel terrible. I didn't notice it. Maybe had a few headaches, but it wasn't anything that it was super noticeable. Now, I wasn't having crazy high blood pressures. They weren't, it was in the maybe 150s over, something, nothing crazy, nothing that would have really given me a lot of symptoms. So I didn't notice a lot. I just was always up to date. I was probably taking my blood pressure a couple times a day, or maybe if I went down the stairs and so, I was like all out of breath because, carrying a baby and all the other things. So those are the things I might monitor extra, but I wasn't feeling awful.
Oh, good. And then how has this pregnancy gone so far with that? Are you, I'm sure you're obviously monitoring right away now. Have you been okay so far with that?
Yeah, I've been really good this time. For me, I went on a little bit of a weight loss journey last year. So I was actually able to be down like 30 pounds. And I have at the thinnest I've been at the start of any of my pregnancy. So I think that's helped me a little bit, but I haven't had any blood pressure issues. Like I said, it's been really good. They check the urine every time. So all has been well there.
Good. Was that journey like a factor because of like the high blood pressure and stuff, or was that unrelated?
I think that's in the back of my mind a little bit, but for me, a lot of it was, mentally last year, I was just really unhappy with myself. Motherhood is hard and kind of lose yourself a little bit in it. Yeah. And I wanted to feel better about myself. I wanted to put on a shirt and not feel bad about it. So that was mainly for me. And I lost 30 pounds. So I was really happy about that. Honestly, it was one of those things that was hard for me to want to try for a baby because I kind of wanted to go for another 6 months or a year to see how well I could do. But I also know, okay, I'll be 34 in June this year. We're cutting it close on, I didn't want to be a geriatric pregnancy. So I really wanted to get it in before 35. So I also didn't want to go too late with my history of the preeclampsia and everything. So that kind of helped me. So definitely feel better this time around when it comes to the weight part of it.
Yeah, that's awesome. Yeah, the weight stuff, my gosh, like you said, you feel like for me, I gained like 60 pounds and that was just shocking. Like, oh my gosh, I don't know if you experienced this, but the first time was far more shocking than the second
Yeah.
time.
Yeah.
You know, the second time I was like more like, okay, I'm embracing this weight gain and this
Right.
belly and whatever. But the first time I was just like, oh my gosh, this is really hard to see my body change
Right.
this way, you
The
know?
first time I
Oh
only
my
gained like
gosh.
20 pounds, and that's mainly because I don't count the 10 pounds I lost. So
Oh,
it's
okay.
20 pounds from what I started, but you know, technically I lost 10 pounds, then gained 30. But
Sure.
the second time I gained a lot more weight because I wasn't sick
Yeah.
and I had the cravings, and my cravings weren't as healthy the second time around. So I gained a lot of
Gotcha.
weight early on. And I remember, I had a OB student, and she had to come in for the appointment, and she came in and she goes, well, it looks like you've gained this much weight. And I knew this.
Oh,
I knew personally
yeah.
that I had not done well. And I instantly like started crying on this poor the student. She was just trying to tell me like to be healthy. Like that's all she was trying to do. And I felt so bad. And I was like, well, she'll learn from that. But I felt terrible. My OB came in. She's like, we're not like upset. And I was like, I know, I'm just emotional. Like, I know I'm already hard on myself. And she goes, I just want you to be like comfortable. Like, it just makes delivery harder when you gain all this weight. And I was like, I know. And so it was just one of those situations. So for me, my second pregnancy, I gained a lot more. But my first one, I looked a lot worse because I had all that fluid. So, but I'm hoping this time that I can, we can reel it in. So far, since my last appointment, I hadn't gained any weight. So the hope is that it's minimal throughout this pregnancy so I can get right back on track afterwards.
Yeah. Yeah, that was like just so frustrating with the practices. And I'm sure a lot of people maybe can relate to this, but like they kept being like, well, you should only gain 20 pounds or 20, maybe 30. It like made me feel bad, but I was like, I'm not doing anything wrong. I'm not like eating for two. I'm just, I'm living. This is what my body does.
Right.
Both pregnancies, I gained about 60 pounds.
Yeah.
And you feel so bad. You're like, oh my gosh, like, am I doing something wrong? Like I'm, almost 30, 40 pounds more than they recommend. Some people's bodies just do that. Like, don't make us feel bad about it.
I know. I
mean, yes, be conscious about what you eat, I guess, but like, it's hard. It's hard. It's very hard. And it's just frustrating that there's so much focus on that.
Yeah.
Because sometimes that's just what our bodies are going to do. And like, why are we putting that down?
Exactly.
We're intended to do this.
And for me, I was lucky. The baby weight came off each time. It just took me about a year and a half each time because I didn't try. It's not like I was dieting or doing anything like super extra. It probably could have came off faster, but I never was going to put that pressure on. And it came off both times, but I needed to lose that before the baby. So that's my goal at this point is don't worry about what the baby weight has done. Worry about where you want to be health-wise at the end.
Totally. Yeah, that makes sense. So what's something that you wish you would have known before being diagnosed with preeclampsia?
The only thing I probably would have wanted to know is what's going to happen. What is an induction going to look like? What does C-section look like if that came up? Kind of just informing myself on how's the process differ from, a normal labor, and just getting more aware of what's going on. Like I said, I had that magnesium drip. It wasn't great, but it had to be done. And, I just wasn't aware of it. No, the nursing staff did a great job of being like, this is going to hit you and it's going to feel really crappy for a little bit, but just informing myself ahead of time. And maybe preparing for that a little bit more. Like we all know there is a million blogs and informational things out there of what to pack in your hospital bag. And you're not going to know what's right for you until after you have your first baby. I mean, and so there's a lot of things I'm like, God, I wish I would have had that fan because some of those medications like sweated me out, like no other, like certain things like that so that might've been helpful, but that was it. And that's just because I like to be informed. I like to know the root behind a lot of things.
Yeah. Were you super surprised about like the postpartum aspect of it and like the lasting hypertension?
Yeah, I was quite surprised by that. I knew that it could last after birth. I just didn't assume it could turn into like a long-lasting hypertension.
Yeah.
I assume that like, okay, once your body's healed up a little bit, it's going to go back to normal and it's going to do what it's supposed to do. So I didn't realize that. So I remember at that 6-week appointment, she's like, it's still running high. So, and going into the fact that now you have hypertension, now you're going to have this treated differently by your primary care physician.
Yeah.
So that was more surprising to me. But just like any other person, a lot of hypertension is usually genetic and age related, diet related, all those things. If you can adjust your diet, for me, it was, losing some of that baby weight helped probably take that pressure off. So some of those things, making those adjustments, just like anyone else that gets diagnosed with it, a lot of times you can come off that medication. Not always, there are times that, the skinniest of people who eats a beautiful diet, they're just going to have hypertension because genetically that's how they're made. So not always, and I know there's a very good chance that later in life I will have hypertension. Like I said, I have a family history, very strong family history of hypertension. So it's always been expected to me. I just didn't think it would come to me in my 20s because of pregnancy.
Right. Yeah, that makes sense. What would you tell somebody that's initially diagnosed with preeclampsia?
Like I said earlier, that back in the day, I mean, preeclampsia was essentially a death sentence. They couldn't treat it. They couldn't barely do C-sections, and it was horrible. So, we can be grateful for the science that we have. I would say, talk with your doctor, go over your options. I'm sure they'll go over diet changes and, put in the aspirin, but make sure you pay attention to what they have to say. They know what they're talking about. Listen to them, do what they're telling you to do, and ask all the questions. It's okay to ask a million questions. They'll walk you through it, go through the different scenarios, use the resources that are out there. TikTok is not like the epitome of all social media, but there's a lot of really useful information out there. And some of my favorites are the medical people, the nurses, your OB nurses, your MDs, your pediatric doctors, and they give a lot of really good information. So listen to what they have to say and let them ease your mind a little bit and, be prepared for a not so normal labor and be okay to make those adjustments because they're just trying to do what's best for you and baby.
Yes. Perfect. I love that. All right, Jen, thank you so much. This was such a good chat. Very helpful for people who are going to be diagnosed with it or have been through it. Just so good to know. So I appreciate you sharing your journey with that. So
yes,
thank you
not
again.
A problem.
It was good to chat and good to catch up. So, all right, friends, if any of this has resonated with you so far, please take a moment, leave us a comment. We'd love to hear from you. Let us know your thoughts. Also, if you enjoyed this episode, check this one out too. I think you're going to like it.